Hi, my name is Dr. Garth Sliz, and this is an introduction to the diagnosis of normal sinus rhythm. In this series of videos, I will help the beginner understand the basic physiology behind ECG interpretation, and since most ECGs are diagnosed as normal sinus rhythm, we will begin there. The sinoatrial node depolarizes spontaneously about 60 to 100 times per minute when a person is at rest. That depolarization spreads to the cells of the atria, causing atrial contraction. And this atrial contraction depolarization causes the P wave. The AV node then slows the overall depolarization down a little to allow for ventricular filling. Then there is a short left to right depolarization of the septum, giving the Q wave. The depolarization then travels through the bundles of His and the Purkinje fibers to the subendocardial tissue and then the cardiac muscle. This gives the R wave. And then some of the superior aspects of the left and right ventricle are depolarized in the opposite direction at the end, giving the S wave. The atrial repolarization is hidden in the QRS, but the ventricular repolarization makes up the T wave. The chemical depolarization of cardiac cells causes the electric potential to go in a positive direction. If you get a positive electric potential going in the direction of a positive electrode, then the resulting waveform will be deflected upwards. So one can see, since the heart depolarizes from the SA node at the base of the heart towards the apex of the heart, which is in the direction of lead 2 and the other inferior leads, that a positive deflection of the waveform will occur in those inferior leads. The T wave is positive because it is a positive to negative repolarization towards a negative charge, but it goes in the opposite direction, so therefore it is a double negative, which causes a positive deflection. So let's have a look at lead 2, and we will see that positive deflection beginning with the P wave. We note that in leads 2, 3, and AVF, all three inferior leads, that there is a positive upgoing P wave. This would indicate that the depolarization originates in the sinoatrial node. Then we want to see if it is depolarizing at a regular basis, and we see that the RR interval is the same. So with a regular RR interval and an upgoing P wave, then we know that we have a sinus rhythm. After the sinoatrial node depolarization through the atria to the AV node, we next want to assess the depolarization through the bundles of His. We do this by looking at the QRS complex, and if we have a closer look at that QRS complex, we note that the width of the complex is less than 0.12 seconds, or 3 tiny boxes, which indicates that the depolarization passes through those bundles at the proper rate, and if this happens, then we know that it is passing from the AV node through the bundles of His and the left and right ventricles without any difficulty. Next, we want to assess whether this is happening with the proper timing. So we first start with the PR interval, and that should be one large box, or 0.2 seconds. Then we want to assess the QT, and that should be less than 50% of an RR interval. If those things occur, then we know that the timing of the depolarization is adequate. Lastly, we want to assess the repolarization, because that tells us some information about any ischemic changes and also some information about the T wave. So when we look at the T waves themselves, we want them to be upgoing in all leads except AVR, which can be sometimes negative. And we want them to be the proper height. We want the ST segment to be at the baseline, not depressed or elevated. And we want to check all the different leads for this. So if we have the ST segments not elevated or depressed, and we have the T waves normal, then we know that repolarization is normal. So now we have assessed the atrial depolarization with the P waves, the QRS complexes, the timing of the intervals, and the ST segments and T waves. And if all those are normal, then we can diagnose this sinus rhythm as a normal sinus rhythm.